I was born in 1960, so I remember the doctor being in the neighborhood. We had one doctor as a kid, and we didn't have no money in my family, but it was a doctor that I had all the way up to 10 years old until we moved further out in Long Island, in Roosevelt. But that was a normal case. What was that? What caused that turning point from the physician in the neighborhood that it would make house calls and house visits to this area that we're at right now where, you definitely have more sickness and people talk about the foods and the air and all these other things. But what was that turning point that took it out of the neighborhood from the neighborhood physician into this?
To the hospitals. I feel like Dr. Frieden probably take that, right? Yeah, you take it.
Well, did I ask a hot question or something?
I probably could say it in a few words. No, but we have a for-profit healthcare system. We have a system that is not, people to have your own private practice now, it's very difficult because of insurance companies, because of hospital consolidations. It just is economically not difficult to survive as an independent primary care or practitioner.
So there's not a quick answer to that, to be blunt. First off, we shouldn't romanticize the past. Lots of people didn't have a doctor. We were living shorter lives. There was less good stuff to do with healthcare. For all of the bad things happening today, we have better tools than ever in human history, better diagnostics, better treatments, and much better vaccines. But I'll tell you a story. My very first job was as a community organizer in the Mississippi Delta area. And I was working, posted to a community health clinic, the Douglas Community Health Clinic, a very interesting community. It was actually a community where they had taken families that had been sharecropping and given them land under a New Deal program. They had built a new community health center, and it was gorgeous. It was gleaming, new, and people weren't coming, and I didn't know why. So I guess even then I was worried about feedback loops. So we did a random survey of more than 350 households randomly distributed through the 10,000 person catchment area. And what we found was 50% of people didn't know the clinic existed. 80% of people didn't know that it had a sliding fee scale and you had to pay almost nothing if you didn't have much money. And virtually nobody knew that it had a van that could pick you up and drop you off. And the people who did know were the people who didn't need to know.
Okay.
There is something called the inverse care law, which you may have heard of, which is basically whoever needs services the most gets them the least, and vice versa. And to swim upstream against the inverse care law, you really have to structure things right. But we have in this country a healthcare system that pays more and accomplishes less than any other health system anywhere in the world. It would be really hard to pay more and get worse health outcomes. In fact, nobody does it.
Yeah, we are an outlier in the worst way.
Yes.
In that way.
Is every state different?
Yeah.
Is every state different?
Yes. There's a lot of differences among states, but the federal government and our overall healthcare system structures things. And I go into this. I want to focus on one particular health condition, which is high blood pressure, hypertension, because it is the leading driver of preventable early death in this country, and it's the single leading driver of the difference in life expectancy between Black and white Americans. So it's bad for everybody, and it's particularly bad for Black communities in this country. In fact, about 2/3 of all Black adults in the United States have unhealthy blood pressure. 2/3. Now, high blood pressure is really bad, because with every single beat, every single second of every single day, the heart is pushing blood and slamming against the brain the kidneys, the heart, increasing the risk of early death, early stroke, early heart attack, disability, dementia, and it's preventable and treatable, and we're not doing that. So why not? Well, because it doesn't pay. Plain and simple, because it doesn't pay. Look, there's a health system in this country that gets it right. It's called Kaiser Permanente. Their doctors are no smarter than other doctors, but their incentives are aligned. If they keep people healthy, they make more money because the payer and the provider are the same. In most of the healthcare system, if you're a dedicated doctor and you do a really good job and you get your patient's blood pressure controlled, you won't get a nickel more. And your healthcare system will make a lot less money. If you don't do that, there are going to be strokes and heart attacks, rehabilitation. Your healthcare system will make a lot more money. I do not think there is a single doctor in this country who wants their patient to have a heart attack or stroke. But we've structured our system so that that is the outcome. And we can, I think, change that and get back, because there was a reality. My father was one of those doctors. Your mother was one of those doctors, right? Who, they were there for the community. They knew people. They knew whole families. They knew kids when they were born until they were adults. And that can happen if there's an economic incentive to make that happen. In Kaiser Permanente, you say, oh, well, if we have to keep people healthy, we need a team. We need not just doctors, but nurses and pharmacists and community outreach workers and social workers. And we're doing that not because we're kind and nice people, though. We are, of course. We're doing that because it makes economic sense. When I was CDC director, and I talk about this in the book, one of my big failures was the attempt to increase blood pressure control rates in the US. I got the White House to sign off. I got HHS to sign off. I got every national organization to sign off. I got thousands of community clinics to sign off. I thought we were going to do great. We started off at about 48%. We wanted to get to 60% control, and we got to 44% control. We moved the needle in the wrong direction.
Wow.
And it's ultimately because if it doesn't pay, it's not going to happen. And if we can change our healthcare system so that the interests of the doctors, because they want to provide good care, are the same as the interests of the patients and the payers, then we can have a healthcare system and a system that pays primary care doctors. Because the short answer to why that doctor isn't there, because they don't get paid. Medicare pays less than 5% of its total spending on primary care. If you are a wonderful primary care doctor, you work for 20 years, dedicated, you will make less than half as much money as a surgeon who graduated yesterday. And the only way we can change that is by changing the underlying incentives of the healthcare system.
Well,